It's time to start your exercise routine for tension-related chest pain. Exercise 1. Massaging the latissimus dorsi muscle. You need a BLACKROLL for this first exercise. The softer BLACKROLL Med FASCIA roller is particularly suitable if you are sensitive to pain. Place the roller on the floor and lie on it with the right side of your ribcage. Slowly and carefully roll along your flanks. The movement is generated with your legs. Fixate on a point every once in a while and tilt your upper body back and forth. In order to work your whole chest, you can also turn your upper body back and forth while rolling. If you've never rolled on the side of your chest, this exercise may be painful. Don't worry, it will get easier with repeated use. We're going to roll for 1 minute per side. Be sure to roll up to your shoulders. Time to switch sides. Lie with your left flank on the roller and perform the same movement as before. Make sure you are going at a leisurely pace. Take deep breaths in and out. Try to relax as much as possible. If the pressure is too much for you, you can also perform the exercise while leaning against a wall. And 5, 4, 3, 2, 1. Let's take a short break. Exercise 2. Massaging the upper back. You need a BLACKROLL Ball 8 for this exercise. Stand with your back to the wall. Place the ball slightly to the left side of your spine, in line with the bottom of your shoulder blade, along the area between your spine and your shoulder blade, until you get to the junction between your shoulder and neck. If you feel a painful point, stay there for around 10 to 15 seconds. Relax your muscles and let yourself sink deeply into the ball. Find a painful point in your upper back and focus on it. Take deep breaths in and out, and relax your muscles. Roll up and down again briefly. Tuck the ball into the right side of the spine between your back and the wall. Clasp your hands in front of your body and start moving. Find a painful point on your right side and focus on it. You can control the pressure with your upper body. Continue leisurely rolling on the ball. Also be sure to try and find a tense spot in the upper part of the spine, and stay on it for about 10 to 15 seconds. Roll briefly down and up again before moving on to the next exercise. Slowly come out of the position. Exercise 3. Massaging the chest muscles. Stand with your stomach against the wall. Tuck the ball 8 between the block on the wall and your chest. Work all of your chest muscles by moving up and down and from right to left. Raise and lower your arm to mobilize the tissue under the ball. Continue massaging your chest muscles a little longer. Lift your arm up and down again. Stay relaxed and, depending on how you feel, put a little more pressure on the ball. Now it's your other chest muscle's turn. Switch sides. Your left side will now also be gently massaged for about 1 minute. Start with circular up and down movements. Lift your arm and lower it again. Stay on a painful point and slowly sink deeper into the ball. Repeat the massage. If the block and ball slip, just reposition them. Lift and lower your arm again when you have found another spot. Then slowly come out of that position. Exercise 4. Twisting the chest muscles. You need the BLACKROLL twister for this next exercise. Place the twister on a painful spot in your left chest muscles and let the nubs sink into your tissue for about 5 seconds. Make slow, circular movements with even pressure, alternating in both directions, and making sure that your tissue under the twister twists along with it. Hold the end position of the rotation briefly each time. Work all of your chest muscles this way. Each painful point should be twisted several times to the left and right. By twisting the connective tissue, you achieve a completely different massage effect. Now put the twister on the right side of your chest and start twisting the individual tender points. Try to relax as much as possible while doing so. You can vary the pressure on the tissue using your hands. Work all your chest muscles on this side as well. You can twist each painful point several times in both directions. You can now relax for a few breaths. The next exercise will be starting soon. Exercise 5. Triggering the chest muscles. Now it's time to do a trigger point exercise. You will need the BLACKROLL TMX Trigger Plus for this. Position the trigger on your right chest muscles and stand against a wall or door frame. Use this to trigger a tender spot in your chest. As soon as the pain eases slightly, you can raise your forearm and stretch it. This is how you create additional mobilization. Trigger the spot for a total of 3 minutes. Treatment with the trigger may seem like it takes a while. However, in order for your body to feel the positive effects, you should linger on a painful point for at least 3 minutes. Try to relax as best you can. To do this, focus on the body parts you are treating with the trigger tool. Just a little longer until you switch sides. Hold it for another 30 seconds and apply gentle pressure once more. Time to switch sides. Bring the trigger to your left side and position the trigger on your chest. Use this to trigger a painful spot in your left chest muscles. Hold for another 3 minutes. Once the pain starts to subside, start mobilizing your muscles again by moving your forearm. By the way, taking deep breaths in and out activates your diaphragm and the parasympathetic nervous system. What does that do? your body relaxes and tightness eases. Make sure you are practicing conscious, deep abdominal breathing during the exercises. Treatment with the trigger tool also promotes blood circulation. In order to be able to release tension in the tissue, oxygen-rich blood must reach the cells faster, and oxygen-depleted blood must be removed more easily. You're almost done. Just 30 more seconds. And 5, 4, 3, 2, 1. And you're done. Exercise 6. Mobilizing the thoracic spine. Now we are going to start with the mobilization exercises. You will need a BLACKROLL FASCIA roller for this. Lie on the floor on your side. Stretch out your right leg and place your left knee on the BLACKROLL at a 90-degree angle. Extend both arms straight out in front of you. Move the left arm over your head to the opposite side. Your gaze should follow the movement. We will now repeat this 10 times. 5, 6, 7, 8, 9, 10. Switch sides. Now stretch out your left leg and place the right knee onto the BLACKROLL at a 90-degree angle. Extend your arms in front of you and start circling them again. Try to keep your right arm as close to the floor as possible. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exercise 7. Opening up the shoulder and chest. You will need the BLACKROLL again for the neck stretching exercise. Lay the roller down on the floor and get on all fours. Support your body with your hands on the roll. Move your head down toward the floor and push your buttocks backward. Lower your head and chest between your arms in this position. Take deep breaths in and out. We are going to stay in the stretch for 15 seconds, 4 times over. Slowly come back up. Take a deep breath and go back into the starting position. With each exhalation, you can let yourself sink a little lower toward the ground. Come back up. Take a quick break. And stretch again. Your shoulders should feel looser now. One more short break. Bring your torso back into position. Take a deep breath and go back into the stretch. You're done. Now it's time for the 2 strengthening exercises. Exercise 8. Single-arm row. Secure the BLACKROLL multiband in front of you at hip height while on your knees. Your left leg will be planted on the floor, and hold one of the loops with your right hand. Activate the muscles in your core and buttocks. Now pull your elbows close to your body and draw back. You're going to do 3 sets of 10 repetitions on each side. 9, 10. Now switch sides. Take the fitness band in your left hand and raise your right knee. Repeat the rowing movement. 3, 4, 5, 6, 7, 8, 9, 10. Now switch to the right side again. Make sure you keep your shoulders down. Start the rowing movement. 2, 3, 4, 5, 6, 7, 8, 9, 10. Time to switch sides. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One more time on both sides. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One last time on the left side. 1, 2, 3, 4, 5, keep going, 6, 7, 8, 9, 10. Exercise 9. Shoulder blade push-ups. Okay, this is the last exercise. Get into a kneeling push-up position with your arms stretched out. Tense your core and buttocks. Let your upper body sink down. Keep your arms stretched out. Next, push yourself up as far as you can go. The movement should stem exclusively from your shoulders. You're going to do 3 sets of 10 repetitions. 6, 7, 8, 9, 10. Let's take a short break. The exercise becomes more challenging the closer you move your pelvis toward the floor. Once you are more advanced, you can also do the exercise in the push-up position. Second set. Get back into the kneeling push-up position. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a quick break before starting the last set. Then you will be done for today. Okay, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's it for today. For a noticeable effect, perform the exercise routine for chest pain 2 to 3 times a week. Until next time.